So it is Rare Disease Day, and as most of our followers know, my daughter Mia has Edwards syndrome, also known as trisomy 18. So Edwards syndrome affects roughly every 1 in 2,000 pregnancies. However, only about 1 in every 5 to 6,000 live births. So that does take into account miscarriages and abortions. I also wanted to talk about how many people, including Mia, with a rare diagnosis like trisomy 18, for instance, also have many other diagnoses that are also pretty rare. And it is something that is really misunderstood, I feel like, and that's ultimately why I wanted to come on here and just do a live, just me speaking on that matter. So I wanted to kind of just go through some of Mia's diagnoses that are pretty rare in themselves. And when you think about factoring all of those complexities together, it's so difficult. And I just think it's really necessary to raise awareness on this topic. So for Mia specifically, she was born with a heart defect, a couple of different heart defects actually, and she has had 2 heart surgeries. Congenital heart defects impact about 1 in every 100 births. So about 1% of the population. And so, I mean, it's not crazy rare, but it's not happening to everybody by any means. And once you have a heart defect, normally you are followed for your life. Even once repaired, hearts change, and it's critical that you get continuous care and monitoring to ensure that your heart stays stable. And so for Mia, her heart is doing wonderful, and they don't anticipate any significant changes with that, but it is critical that she gets echoes frequently and monitoring frequently to ensure if there is any change, it's caught timely and that it can be intervened on. So she has the heart defects, and she has pancreatic insufficiency, which in pediatrics is very rare. So normally it is tied to cystic fibrosis, which cystic fibrosis is very rare. And so when we got this diagnosis, it actually became a little bit of a scare that Mia might have cystic fibrosis. And it was actually even weirder because at birth on her newborn screen, she tested positive for cystic fibrosis. She did a sweat test not too long later, and they, confirmed that it was a false positive. But then when she got this pancreatic insufficiency diagnosis, it resurfaced again. They wanted us to get another sweat test that also came back negative. Then there was discussions on, does she have a mutation of cystic fibrosis? And, that was looked into, and it's pretty much been concluded that it seems that Mia has some form of idiopathic pancreatic insufficiency. So essentially it's surfaced because of an unknown reason. And this is rare. So I'm in a group on Facebook for pancreatic insufficiency, and there's literally only a couple hundred people in it. So that shows you, and that's the only pediatric support group that I can find on Facebook. Now there's an adult one that has a lot more people in it, so it is more common in adults, but still not super common either. So she has pancreatic insufficiency. As most of you likely know, she has epilepsy, and I believe that the statistics on epilepsy is that it impacts about 1% of the population. Now, I just want to put a disclaimer out there that I am not stating that these statistics are 100% factual. Some of this was just pulled from Google, and with anything rare, you're going to get different answers and information depending on where you go. It is just because, with certain things like trisomy 18, for instance, like I read different statistics depending on where I'm looking, and it's really hard to know what is accurate. And I don't think that it's anybody providing misinformation or, intentionally doing anything like that. I just think that some diagnoses are so rare that it is really hard to actually know what the statistics are. So if anybody has, accurate information and I'm saying anything incorrectly, just go ahead and throw it in the comments, because we're all here to educate each other, and I think it's important to do that. So she has epilepsy, and then she was just recently diagnosed with hydrocephalus, which I believe hydrocephalus impacts about 1 in every 700 or so babies. It is even more rare if it's an idiopathic hydrocephalus, which for Mia, we don't really know. Because she was just diagnosed at age 4. Now, we believe that she has had it for at least a year because she had symptoms and we just could not get to the diagnosis. the diagnosis of hydrocephalus until January, but we don't know if she was for sure born with it or if it, just surfaced in the last year or so. So again, it's rare. It's rare for, a baby to be born with it. 1 in 700 is, that's still pretty rare. And it's even more rare if it surfaces later on in life, especially at a younger age of age 4. So again, regardless if she's had it in some variation her whole life or if she just developed it in the last year, it's a pretty rare diagnosis. Another one is conductive hearing loss. So Mia has hearing loss, and it's due to small ear canals, which is called conductive hearing loss. And conductive hearing loss is one of the most uncommon types of hearing loss. So essentially, sound has issues getting through her ear canals. For the longest time when she was little, she wore what's called a bone anchored hearing device right behind her ears. It was like a band, and then there'd be one right behind her ear that would vibrate with sound, and it would essentially bypass her ear canal so the sound could get to her through her ear canal. That didn't really work well for her because of her rolling around and just the shape of her head. It would always just come right off, so she didn't wear it enough. So we really advocated hard for other options, which was hard because her ear canals are small. So traditional hearing aids aren't always a perfect option. But once she turned 3, we found an audiologist that was really about trying the hearing aids for her. And so we did, and it's been amazing. Her just awareness and her use of her eye gaze device and stuff like that, just really, really changed once she got the hearing aids. And it was very clear that sound was getting through. So we were very happy that we advocated for that and that we found a audiologist that was willing to give it a try, because we knew that it might not work. And I mean, when you think about it, she's still probably not getting a good amount of sound through them because it still has to go through her ear canal. But we do know that enough sound is getting through for her to be able to hear. And obviously that's better than her not wearing a band that we originally had if it's not staying on anyway. Those are just a handful of Mia's diagnosis that, it's hard to say. Some of this is probably caused from her having the extra copy of chromosome 18. Some of this might not be. That's the other thing. A lot of people deal with just getting, things just getting blamed on the primary diagnosis. And, nobody has perfect genes. Nobody has, everybody has things going on. As genetics increases the knowledge of it and stuff, we're going to find out so much more. And, people are going to find out that they have rare things in their genes and they had no clue. It's said that there's people out there with trisomy 18 that are adults and they have no idea they even have it. It's, it's mind-boggling, really. But really, the point of my video on Rare Disease Day is to just show that somebody that has a primary rare disease is also dealing with so many other diagnoses on top of that are also many times rare. And so when you have to put that complexity of all of that together and find care and find help, it's crazy. And so I just wanted to come on here and say, if you're a parent that is advocating for your child, keep going, keep fighting, keep finding those providers that will listen and are there for you and that care. Keep following your own gut, because when something is wrong or something just doesn't seem right, most of the time you are probably right. And for somebody that themselves is listening to this and has a rare diagnosis, keep fighting for yourself, keep advocating for yourself, keep educating others. It is so critical in this world, because people just don't understand. And, while some people don't want to understand, there are a lot of people out there that do want to understand. They just don't know where to get the information. So I believe that it is our job to, provide information like that. And so that's why I just wanted to come on here and kind of just talk about, not only Edwards syndrome, but also just the other complexities that come along with a rare diagnosis. So I hope that this is helpful for somebody.